Hi guys, hope all is well. So I belong to a group online where there are a lot of oral and maxillofacial surgical trainees that just come together to pool together to, just voice their concerns, um, basically promote the profession, discuss their challenges. So for the last couple of weeks, I've actually been feeling a bit frustrated and a bit down, which is normal. This comes with studying and comes with, pursuing another endeavor in your life where, it's not necessarily sure. So, seeing how I was feeling discouraged, there was someone who actually wrote in and wrote exactly what I was feeling, where they were saying, they feel as though they have taken a step back in their career to advance 10 steps forward. And, it's a humbling experience when you're a medical doctor to actually go back to school now, to sit down in class, to basically be around peers who are much younger than you, and also to be, for want of a better word, not independent. It hasn't been so bad because my class is actually a good mix. So they're mature students and then they're very young students, and most persons in my class actually have a first degree. So my class is very, 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 very qualified. But there's some autonomy that you get once you're practicing as a medical doctor. In an office. Like right now, I'm at work. So this is me at work. Today's actually a very slow day, so I decided to blog a bit. And I have my computer here and I'm studying a bit. So this is just a video just to tell you exactly the challenge, some more challenges that you can encounter. For one, I'm trying to pay my tuition. So I've acquired some money, so I'm going to pay the tuition. However, it's late. So my exams start Monday and this is the weekend. Today's Saturday. So since it's the weekend, for me to pay, I have to go now half an hour before my examination and ask the registrar to register me for the tests, for the quizzes that start at 9 o'clock. So it's hectic, but like I said, I'm trying to keep my eyes on the final prize. Another thing that's also challenging, as I mentioned throughout my videos, is employment. But the good thing is that being self-employed gives me some, once again back to the word autonomy, it gives me some ability to make my own decisions when it comes to working. So for instance, if I have a bit of studying to do, I can kind of just shut down shop and go and focus on studying. And that's been good. But being self-employed doesn't give yourself a lot of security in terms of job security, because even when I was trying to use my job or my business as collateral to pay my tuition at university, because I don't know what happened, but it didn't give me the choice to use it as collateral or even as commitment to pay my tuition. So that was another challenge, and I had to deal with that bit by bit. So right now, finals are coming up. This week I have occlusion, dental imaging, and then on Friday I have preventative dentistry. So this year studying, trying to study and hope that a few patients come in so I can make a little extra money. So oral maxillofacial surgery is not for a person who is looking for a quick buck, or for a profession where you're going to advance quickly. And this is something that people shy away from our profession or our specialty for the same reason, because it takes time. It's 2 degrees. The first degree is usually when you're younger, and the second degree is when you're a little bit older. Probably like you might have worked for a little time and then you actually go into the specialty, go into your second degree. So for me, I haven't gone in so late because I'm still in my 20s. Well, going to be out of my 20s. No, the secretary again. That 20s, the end of this year, and I have a family. So that hasn't been too bad. So I'm not really too far out of the range that would make you say, wow, you're really old to be doing oral maxillofacial surgery. But at the same time, there's still a huge hurdle ahead, because once I finish dentistry, I have to go and look to see where I can actually do the surgical training or the surgical aspect of oral maxillofacial surgery. I'm trying to keep abreast because there's also some things I have to keep in mind. You might ask, why am I trying to continue to work? But the thing about it is, when you're going abroad, they ask you what is your clinical experience. So you can't just throw your medical degree and focus directly on dentistry. You have to keep abreast of medical practice, because if you're not practicing as a medical doctor, it can actually not be in your favor. Because I have a friend or a colleague who is practicing in the UK, and he actually said that they made him repeat some years in his surgical training because he has been out of medical practice for quite some time. So that has him a bit down too. So just remember, when you see somebody who's an oral and maxillofacial surgeon, that they have gone through quite a bit. And being an oral and maxillofacial surgeon is a very long route, but remember, it's a marathon and it's not a sprint. It's not a sprint. If you can just get through these years, you'll start to see, and which is what somebody actually wrote in. So the person wrote in and was discouraged, and then everybody, like me included, wrote in all of our experiences. You know, having a family, supporting yourself through another degree, you know, being dejected, watching your colleagues or your peers finish their specialty training, or even just become GPs, or even go on to other higher education, and you're still doing another undergraduate degree. And this one person wrote in, and they're actually in SD6, which is near the end of their surgical training, and they wrote in and said, well, you know, I felt this way, and I felt this way multiple times throughout their surgical training. And what I really admired about the response was that they said, it's normal. You're going to feel it multiple times throughout your specialty training, or even throughout your degrees. But he didn't try to discourage anybody. He just said at the end, he's at the end of his training, and if he had life to do it back over again, he would do it again. So just keep that in mind. If you're out there and you want to do oral and maxillofacial surgical training, just keep your eye on the prize. It's not going to be easy, but nothing in life that's good comes easy. Nothing. I'm going to study here for an occlusion test, and then I'm going to study some more for radiographic imaging when I'm finished around 3:30, because right now it's let me see, it's about 11 o'clock here. I've been at work for about an hour and a half, so hopefully we get some patients, and when I'm finished, I'm going to go back down to another job whilst I'm going to try to study in between. And this is just the life that we've chosen. Keep focused on your goal, and I hope you continue to subscribe to my channel.